Hi, I'm Dr. Robert LaBelle. In this video we're going to cover the ball home therapy release program for the hips and the low back. So initially we'll go through the low back area. I'm going to have Ariana turn around first and we're just going to demonstrate what we're going to cover with this. I'm going to pull this up. So initially we're going to have Ariana do the low back ball release. We're going to work along the hip bone, the top of the hip, and then she's going to work up along the spine. You're not directly on the bone, you're just off to the side of it. And as you do this ball release, you're doing it slowly and controlled, and you're looking for sore spots. You're looking for really tender spots. And once you're on that, you're going to put pressure into it and just slowly release it. Same thing goes with the ball release. So let's demonstrate that, Ariana. Here's the ball. You'll go against a wall. She's taken a bit of a step away from the wall so that she can get some good leverage up into the wall. She's positioned the ball well. Let's bring your arms up so we can show. What she's going to do is she's going to slowly, incrementally slide across the top of that hip bone. And the purpose of this is to try and target some of the damaged tissue that resides along that hip bone, particularly the QL muscle or quadratus lumborum. And what she's doing, she can find a sore spot, say that's a sore spot, and then just work it right there in a slow, steady fashion. This shouldn't be horribly uncomfortable. It should just be some mild discomfort. And if it's too sore, an alternative that you can do is you can step closer to the wall so there's less pressure. And ultimately that will take less force and it'll feel a little bit better. I'd like you to do both sides of the back for approximately 3 to 5 minutes, doing it 2 to 3 times a week. We want some time in between those ball release programs so that the breakdown work you've done with the ball will allow the tissue to regenerate and get healthier. The second ball release for the low back is treating small little muscles near the spine we call multifidi that sit right off the spinous process, and these big long rope-like muscles we call erector spinae muscles. The ball will be positioned very near to the spine and directly on those big rope-like muscles, and you will be positioned directly against the wall, putting pressure. The idea for this is to go up and down, searching out and finding trigger points and sore tissue, and then slowly releasing it. We'll have Ariana demonstrate that. So she's positioned against the wall. She's taken a step away from the wall so that she can get quite a bit of pressure. If we lift your arms up, the ball is directly on some of those. She's pretty high up, right at the thoracolumbar junction. That's great. And then she's just going to bend up and down in a slow, controlled manner. She's really looking for tenderness here. And as well, you're going to turn your body at times, even the hips. And what that'll do is it'll hit it at a bit of a different angle going up and down. And you'll go through the low back in a grid, working the low back and a little bit higher in the low back, searching out for the sore tissue. Each area, each side of the back is done for 3 to 5 minutes on each side, done 2 to 3 times a week. It shouldn't hurt too much. It should just be uncomfortable at the most. The next exercise we're going to go through, if I have you turn this way, Ariana, we'll just demonstrate. I'm just going to pull this up a bit, is ball release to the glutes. This is hard because this is a large muscle in the human body and there's quite a few trigger points. But for the trigger points that cause low back pain, they typically reside along the top of the hip bone. And so initially she's going to go against the wall like she did with the back, and she's just going to release then. As we go through the hip though, we want to make sure that we don't forget the lateral component of the hip. The hip bone or the iliac crest starts up here and the greater trochanter's up here. So there's a good area in here where there's a lot of hip trigger points that cause sciatica and cause different types of hip pain and bursitis. So let's demonstrate the higher trigger points first, Ariana. Let's have you go against the wall. She's going to go against the wall at a little bit of an angle because the glute is a little bit angled. Pull this up a bit. Bring your arms away. It looks very similar to the low back ball release, however, it's just on the undersurface of the hip bone. She's just going to release through those. Not forgetting to get really close to the tailbone. She can spend some time there and just work right there. As well, work out through the hip. And at some point, you're almost turning so you're perpendicular to the wall. That looks really good. The distance that she's away from the wall will dictate the amount of force. So slowly ease into it, and as the tissue gets healthier, move further and further away from the wall. If we demonstrate the lateral trigger points or the lateral ball release, you'll turn almost so you are perpendicular to the wall. You can reposition if you need to. Good. And what you want to be thinking about here, if we take a quick look at her other hip, is pretend there's basically a grid. You want to be spending time doing some ball work here, more in the front, some ball work on the side, and a little bit in behind. And so there's about 9 spots in here. And what you're looking for is that tenderness and that scar tissue. So right now she's in the back spot, and she's just going to work it back and forth. If that doesn't feel too bad, she's going to turn her body onto the side and just release into there. And if that's not too bad, then she's going to try more the front side, and that's in there. That looks good. And as well, she's going to move the ball down now a little bit to the next spot. The key is going through your hip in a grid and searching out the sore spots and then slowly working them. We do not want you to be working aimlessly here. Really lock into the damaged tissue. Once again, like the low back, you're going to be doing ball work for about 3 to 5 minutes on each side and doing it 2 to 3 times a week. If it gets too sore, then you can back off of that and do it a bit less, and we can talk about what a good treatment regimen would be at home.